Good afternoon to all the dignitaries, professional colleagues, sports person, sports lovers, and participants. I, Dr. Rajkumar Patil, Associate Professor and Moderator of this international webinar, welcome you to all this need of the our topic, that is women and mental health. At outside, first I would like to introduce my department with a few words. The journey of physical education and sports science of Karnataka State Women's University has begun in the year 2007. The journey has been interesting, exciting, and producing several forms of success. More than 250 students have been appointed in different government sectors, including education departments, police departments, and university setups. Department has successfully carried out two major projects and minor projects from UGC and sponsored by others departments. Our department faculty have published more than 300 research articles in reputed journals. Four students have been selected for the media program sponsored by the UGC. Addition to that, more than 40 students cleared DET, Translate, and JRF examination. Our university data sports produce a number of athletes at national and international level. I am proud to inform that the international national player Rajeshwar Gayakwad is also our alumni. Our sports student Savita Annapnar has confirmed with the Ekalav and Rani Kittur Chanam awards. Our success, our success story speaks volume of efforts being carried out by the staff departments under the leadership of former chairman Professor N. Chandrappa and present chairman and convener of this webinars Professor D.M. Jyoti. Now, I would like to speak about few words about the today webinar topics. That is women and mental health, ways and means of preventing and maintaining the psychological well-being. Dear delegates, you know that mental health problems and illness affects men and women differently and at different stages of their lives. Several studies reveal that women are more vulnerable to mental illness in comparison with the men. When it comes to the dealing with the daily stress, women are no less a victim of stressful environments. Even if they are housewife, homemakers, sitting in the comfort of their house, always wearing that bright smile to keep the environment of the house peaceful and joyful. Women's health is often neglected. Men are presumed as the strongest species, hence they are sometimes not allowed to express their emotions, whereas women are supposed to manage their things beautifully and perfectly in every phase of their life, where they don't even have the courage to acknowledge their strange and devastated feelings. The webinar is conducting in association with Akamadi Women's University and Department of Physical Education, Vijapur. Akamadi Women's University is unique for the reaction to the contemporary issues. One of the most neglected issues is being dealt with in today's webinar. Now, I would like to invite the International Webinar Convener and Chairman of our department, Professor D.M. Jyoti sir. Kindly welcome all the dignitaries and introduce the today's speakers. Thank you. Over to DM sir.
It is not audible. Mic unmute ಮಾಡ್ಕೊಳ್ಳಿ ಜ್ಯೋತಿ ಅವರೇ.
Jyoti.
Mic unmute. Okay, fine.
Sir, is it audible?
Yes. Proceed, Jyoti.
Yeah, good afternoon to all. It's my great delight to welcome you all to this international webinar on women and mental health. First of all, I'd like to a warm welcome to our Professor Onkar Gowda Kakade, Honorable Vice Chancellor and Chief Patron of this international webinar. I, on behalf of the department and on behalf of the university, I welcome our beloved Professor Onkar Kakade, sir. I welcome you, sir. Further, I welcome our patrons and pride of our universities, Professor R. Sunandamma, Registrar, Karnataka State Akamadi Women's University, Vijaypura, Professor P.G. Tatsad, Registrar Evaluation, and Professor Vijaya B. Korishetty, Finance Officer. I welcome you all for this international webinar. I would like to welcome our esteemed resource person, Dr. Preeti Patil, consultant psychiatrist. I wish to share a brief introduction of our today's resource person, Dr. Preeti Patil. Dr. Preeti Patil, born in the family of Air Force. Her father served in an Indian Air Force as a wing commander. Since her childhood, she traveled across globe. After completing her schooling from Kendriya Vidyalaya Bidar, she joined MBBS from MRMC Gulbarga and followed by comprehensive psychiatric training from United Kingdom from 2002 to 2007. Her main areas of interest are mood disorders, psychiatric disorders, and addiction psychiatry. Dr. Patil regularly attends conference seminars across the globe. On behalf of the department and on behalf of the Karnataka State Akkamadevi Women's University, I welcome you, madam.
Thank
I'd
you.
like to welcome the organizing secretary, Dr. Rajkumar P. Mali Patil, for organizing this wonderful international webinar on women and mental health. I welcome you, sir. Further, I extend to my warm welcome to all the faculty members and non-teaching staff of Department of Physical Education and Sports Science. Last but not the least, I would like to welcome all the participants, media persons, and all the deans, faculties, chairpersons of all the departments. I welcome you all. Your cooperation shall be the key to our success. This is for exclusively for the participants, those who are participating in this international webinar. Once again, I welcome you all. Thank you. Over to Dr. Rajkumar.
Thank you very much, Professor D.M. Jyoti sir, introducing today resource person Dr. Preeti Patil madam. Thank you for your wonderful introduction. Now I request our Honorable Vice Chancellor, Dr. Patil sir, speak about the deliver speech about the webinar.
Okay, fine. A very good afternoon to all. Once again, I welcome you all to this international webinar on women and mental health, organized by the Department of Studies in Physical Education and Sports Sciences. As you know, COVID-19 is the most significant global shock in decades that has caused considerable disruption to health systems, especially mental health, economies, and societies. The impact of the pandemic COVID-19 goes far beyond the illness itself. We must recognize that this challenge is much higher than just the health sector and that we have to work with the whole of society, whole of government response across traditional defenses. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Mental health includes our emotional, psychological, economic, and social being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Traditionally, women have tended to take on the responsibility of looking after the health of members of their family as well as themselves. For instance, women often shop for their family and influence what they eat or advise their family when they feel unwell. This role makes it particularly important that women understand how the choices we all make in everyday life can affect our mental health. This webinar is rightly organized to enlighten the students and other general public about recent developments of the pandemic and guide the students for keeping good mental health to face the COVID-19 pandemic. I would like to congratulate the convener and organizing secretary and organizing committee as a whole for organizing this webinar, international webinar, and looking forward to hearing from the information on women and health, mental health, means and ways of maintaining psychological well-being by the resource person, Dr. Preeti Patil from UK. Madam, once again, I welcome you for this international webinar. Thank you one and all.
Yes. I felt heartfelt thanks to the Professor Omkar Kakade sir, Honorable Vice Chancellor of our university, for gracing this event and wishing best of luck and expressing the importance of mental health during pandemic situation. Now it is time to invite Dr. Preeti Patil, eminent and leading psychiatric, to deliver their speech on ways and means of preventing and maintaining the psychological well-being of the humans. Madam, kindly proceed with your
Thank you. Thank you. Thank
slides,
you for
madam.
the warm welcome and a good afternoon to all of you. When Dr. DM Jyoti called me and invited me to be a resource person on this webinar, I accepted with great pleasure and honor, because the topic of today's webinar, Women and Mental Health, is a topic that is quite close to my heart. So, having practiced in Bangalore now as a psychiatrist since almost 12 years, I have had the opportunity to work with individuals and families from all different walks of life. So the way that Narayan Hridayalayah is located in Bangalore and the kind of population that it caters to, in a day I meet families from the city of Bangalore, from the rural areas surrounding the outskirts of Bangalore, and there are also a lot of international patients that visit our hospital for treatment. So, I would like to start by giving a definition of mental health and the burden that mental illnesses are nowadays placing on the world as a whole, on societies as a whole. Some of the risk factors that could be resulting in the causation of mental disorders. And I will briefly touch over some of the common mental disorders that affect women in India, briefly go over treatment options, but I would like to spend a lot more time on how do we maintain good mental health, what can we do as individuals and as a community to encourage people, especially women, to develop good mental health. So let me start with the definition of mental health. It is a term which is used to describe a level of cognitive or emotional well-being or an absence of mental disorder. The World Health Organization also has defined mental health as a state of well being in which every individual is able to realize his or her potential, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to their community. It is the ability of an individual to enjoy life and to find the right balance between the responsibilities of life, the daily routine and activities, and be able to achieve psychological resilience. So I'll speak more about psychological resilience as we go ahead, because that is one of the most important factors to promote and maintain good mental health. So the next slide, please. Um, so I will first like to go over the facts and statistics. Globally, 1/6 of all physical health problems, all health-related disorders, globally, almost 1/6 of these problems are caused by mental health. And India accounts for almost 50% of the global mental, neurological, and substance abuse disorder burden. WHO also predicts that in India, almost 7.5% of the Indian population suffers from some form of mental disorder. And by the year 2025, this could increase to almost 20% of the population as suffering from one form of mental disorder or the other. It's not surprising, but very worrying that women more often than men suffer from symptoms of anxiety, depression, unspecified psychological distress to the extent of 2 to 3 times more often than men. So, 3/4 of these mental health issues that affect women start or are established before the age of 24. So, in early adulthood, many of the women who are going to develop mental disorders start showing some symptoms and start getting diagnosed. And young women have emerged as the highest risk group for mental ill health in the world and also in India. Not only young women, but across age groups, women are more susceptible to developing mental disorders. For example, almost 20% of Indian mothers are likely to be affected by postpartum depression. In the same way, during the time of menopause, Indian women are again susceptible to developing depression, anxiety, or stress. The next slide. Yes, thank you. So, unfortunately, in India, violence and abuse is very prevalent amongst families and in society. And violence or abuse is one of the biggest factors that can cause mental health issues for women. In India, the lifetime prevalence rates of violence against women ranges from 16 to 50%, and at least 1 in 5 women in India suffers rape or attempted rape in their lifetime. Suicide, self-harm has become much more prevalent nowadays, and this has been in the news quite recently in the Sushant Singh Rajput case. And almost every day when we hear in the newspapers, we read about women, young people, students committing suicide. So deaths resulting from self-harm in young women has risen in India by a shocking 126% between 1990 and 2010. And a quarter of young women have self-harmed, at least this is twice the rate for young men. However, completed suicide, is much more higher amongst Indian men as compared to Indian women, and this is true worldwide also. But the rates of suicide amongst women in India, especially in the age group of 15 to 49 years, is increasing significantly and has now overtaken maternal mortality also as the most common cause of death for women in this age group. Right? What are the risk factors that can cause mental health problems? And I'm going over the risk factors specifically in relation to women. Right? The first important point is the biological makeup. Now, men and women are quite different in their physical attributes. And one of the most important differences is the presence of hormones in women that make them even more susceptible to developing stress, which in turn is one of the risk factors for causing depression, anxiety, or other mental health illnesses. The hormonal changes that occur in girls and women throughout their life cycle makes them much more vulnerable to develop mental health issues. This can happen at the time of puberty, at the time of pregnancy, childbirth, moving on to menopause. So the entire life cycle of women is a life cycle of vulnerabilities to develop mental health difficulties. Apart from the physical attributes, the psychological makeup of women is also very different when we compare it to men. So there are obvious structural changes, or what we would say the wiring between men's and women's brain. There are obvious changes which occur, and this can cause a lot of difficulties for women when it comes to maintaining good mental health. Right? Men and women react very differently to events, to situations. Men and women respond differently. Their emotional resilience of men is much more stronger as compared to women. Women express their feelings quite differently, react to stress quite differently when it comes to men as compared to men. And this in turn makes them a lot more susceptible to develop mental health disorders. A very important factor in a country like India is also the socio-cultural reasons, which is an important risk factor for women and mental health issues. Women from childbirth onwards are placed often at a disadvantage in our society when it comes to starting from female feticide, starting from access to good quality education, nutrition, marriage at an early age, dowry, harassment, pregnancy, childbirth, balancing jobs and maintaining family. So there are several areas where socially, culturally, the role of women, that role that women play within families, within the society, puts them at a disadvantage, and which in turn leads to stress, which in turn leads to increased risk factors for developing mental health issues. Lack of economic freedom, lack of literacy, increased expectations, increased pressure that families and society place upon women is one of the important risk factors for the causation of mental illness. Another important area which needs a lot of attention, awareness from all of us is the lack of awareness, the lack of education about mental health issues within the society as a whole, and also the difficulty in accessing good quality psychiatric services. This is mainly because of stigma that exists in our society about mental health. We don't often talk about mental health issues. There is a lot of neglect towards women's health in general, especially when it comes to mental health. There's a lot of discrimination and there is a lot of resistance in women seeking treatment or support for their mental health issues. Violence, sexual abuse, unfortunately, a reality in Indian society, which happens in quite a lot of families, and is quite common in our society. So the occurrence of violence, abuse of any form, be it emotional, verbal, physical, sexual abuse, predisposes is one of the important risk factors for women to go on to develop post-traumatic stress disorder, anxiety, depression, may even lead to addictions or substance abuse. There are legal and political reasons, and this I'm speaking from the broader society perspective. There's a lack of a reasonable policy framework, lack of a national strategy to increase education, psychoeducation awareness within the society about mental health issues and about women's empowerment. Now, what are some of the common mental disorders that women are susceptible to develop? I'll go over briefly some of these disorders, and I'll speak in detail about the coronavirus pandemic and how it has affected or increased the presence of mental disorders amongst women in the last 4 or 5 months worldwide and definitely in India. So depression is one of the most common mental disorders to affect uh, uh, people and women also in particular. It is the leading cause of disability. And WHO has said that we are heading towards an epidemic-like situation very soon as the levels of depression in society as a whole is increasing. Now, very often we use the word depressed, but depression is very, very different from sadness, which we all feel from time to time. The difference between sadness and depression being the duration and the intensity of the feelings. So our mood goes through its routine fluctuations, but it still stays within a healthy range. And we do feel sad from time to time, but we usually bounce back pretty quickly. A person who is depressed, we would diagnose a person with depression if they display low mood, maybe frequent crying spells. If you can change the slide, and I have listed out some of the common symptoms of depression. So if any of these symptoms are present for 2 or more weeks, for most of the duration of the day, then we are able to diagnose a person with depression. And some of the common symptoms of depression are feelings of sadness, hopelessness, worthlessness, emptiness, crying frequently, no longer enjoying our favorite activities, loss of energy, tiredness, fatigue, the inability to focus or decide, the inability to sleep, or on the other hand, sleeping too much or struggling to get out of bed, loss of appetite, weight loss, or overeating, on the other hand, in an attempt to feel better. Sometimes this is associated with thoughts of self-harm, thoughts of suicide. And sometimes it can also be associated with mainly physical symptoms in the form of persistent headaches, nausea, or chest pain, or any other physical pain, aches and pains in the body, or tingling, numbness in the limbs that there is no physical cause to explain this, or it doesn't improve with treatment. Becoming easily angry, irritable is also one of the symptoms of depression. Apart from the main depressive disorder, the hormonal changes that women go through also make them very susceptible to develop other forms of depression. And we bring this under the broad umbrella of perinatal depression, a subset of which I will discuss a little later in this presentation. If we can change the slide, please. Yeah, to the next slide. I'll now talk about anxiety. The next slide, please. Can you hear me? Yes. So anxiety is also related to depression. Some of the same neurotransmitters are involved in this process. The difference is in the presentation of the symptoms, right? And one of the most common presentations of anxiety is generalized anxiety disorder, in which a person experiences excessive anxiety or worry for most days. And if these symptoms last for a period of more than 2 weeks, up to 6 months, then we diagnose this as an anxiety disorder. Other related anxiety disorders include panic disorder, obsessive compulsive disorder, very commonly what we experience in society, social anxiety disorder, and phobia related disorder, that is fear to a specific area, specific issue, such as some people have a fear of flying, some people have a fear of heights, fear of closed spaces, fear of specific objects, fear of exams. So a fear to a specific situation or fear of a specific object is called phobic anxiety disorder. Now, generally, some of the common symptoms of anxiety include, again, chronic irritability, nervousness, fear of impending doom or disaster, the feeling that I'm going to die at any moment. It can be associated with physical symptoms such as giddiness, nausea, tiredness, weakness, chest palpitations, difficulty in breathing, dry mouth, chest pain sometimes, sweating, trembling of hands and legs, difficulty in concentrating, sleep disorders. It can also cause associated physical symptoms such as stomach aches, loose motions. It can cause acidity, feeling of gas, trembling or tingling, numbness in the limbs, headache, sometimes chronic headache. These can all be, so anxiety can manifest in all these forms. Now, I'll speak a little bit about the coronavirus, the pandemic situation that we are all over the last 6 months, the lockdown, which has been an unprecedented event in our lives, and the effect that it has had on the mental health of young people. So it's undoubtedly the pandemic and the lockdown has caused a significant disruption to our daily life. Students especially have been badly affected by the virus because they have been locked up at home for almost 6 months. Colleges have shut down, schools have shut down, regular life, social life has come to a standstill, and children and students have had to return back to their homes, leaving their hostels, or and have had to disconnect from family and friends. There's a general sense of fear in society now, the world over, and an extremely negative environment seems to be developing. So whether we switch on the TV, whether we call friends, whether we open our phones, it seems to be full of negative news. And there's a fear of impending doom within society now. Students have also had to experience a lot of uncertainty because of the sudden closure of colleges and classes. There are exams pending. There's a lot of uncertainty. It's difficult to make any decisions about conducting classes, conducting exams, about students who are going to pass out soon, their future. They're looking out for jobs in a very negative economic condition that our country is going through. Students who still have to start online classes, faculty, teachers, students, everyone has had to make the shift to digital learning, starting to record classes, live classes, which in turn brings up its own challenges. So there is a difficulty in accessing smartphones, laptops with proper internet connectivity. There are frequent power cuts that happen in our country. And all of this has increased the challenge of accessing learning on a day-to-day basis. So this has caused a lot of disruption to the lives of students. combined with fear, combined with anxiety, combined with uncertainty, on top of loneliness, because students are now unable to meet out in groups, they're unable to spend time with their peers, with their friends, they're restricted at home. And this in turn has caused a lot of boredom, a lot of loneliness. So there are reports which show that the first couple of months of the lockdown, students was the one population which was quite undisturbed and unaffected by the effects of the lockdown. But as time has passed, there has been a steady increase in episodes of anxiety, depression, suicidal ideation, anger management issues among students. And this is not unusual given the current circumstances that we are in. So next slide, please. So the next condition that I'm going to speak about is bipolar disorder. Now, this has been again quite, we have heard this in the news quite often nowadays. And it was previously referred to as manic depressive illness. Now, bipolar disorder usually consists of both manic and depressive episodes, and with in between periods of quite normal mood. Now, this is different from the usual mood fluctuations that all of us experience in day to day lives, because our mood tends to fluctuate between a very healthy and normal range. While in bipolar disorder, the fluctuations can be quite extreme, they can be quite excessive, and they can cause significant disruption to a person's life and daily activities. During the manic episode, it is characterized by elevated mood, irritable mood, overactivity. There can be a lot of grandiose thinking, rapid speech. There is reduced need for sleep. And this can alternate with depressive episodes where there can be oversleeping, lack of eating, lack of work activity, suicidal ideation, excessive crying spells, and persistent low mood. Now, these mood changes can happen once in a few months, and it is treatable, though it is a serious mental disorder. And women generally are more susceptible to develop bipolar disorder in their mid 30s or 40s as compared to men. Uh, Next slide, please. So, postpartum depression again is a very, very important area, because many women in the reproductive age group are also at the same time going through the end of their educational journey or at the beginning of their careers. And the same time, the biological clock is ticking, and they tend to get married around the same time. They tend to get pregnant or have kids and bring up children. So all this can increase the stress and the tension that women have to go through while trying to strike a balance between their professional and personal lives. Now, baby blues is a condition that is very common and which many new mothers experience within the first 3 to 4 days of a baby being born, and these symptoms can continue till almost a month post delivery. And these are just caused by worry. There's a lot of exhaustion, there is sadness, maybe the time taken to recover from the effects of pregnancy and delivery. And this is usually, it resolves by itself, usually no treatment is required. But postpartum depression, which is also a very common condition, can affect almost 1 in 5 women in India. And the symptoms usually start within the first month of giving birth, but can start any time within the first year of having given birth. And this is usually characterized by feelings of extreme sadness, extreme anxiety, crying spells, tiredness. And this in turn affects the woman's ability to take care of herself and definitely take care of her baby. It can also sometimes lead to suicidal thinking or thoughts of harming herself and her baby. What is the cause of postpartum depression? Again, a hormonal fluctuation. There is extreme hormonal changes that happen during the course of the pregnancy and around the time of delivery. There is lack of sleep, there's tiredness, exhaustion in the weeks leading up to the delivery and the first few months post a baby's birth. There's pain related to pregnancy and childbirth. Apart from this, there are several social considerations also that can increase the risk of developing postpartum depression. usually many of these events in a woman's life, marriage, pregnancy, childbirth, naming ceremonies, can bring about with it a lot of stress within the family. And in our society, during pregnancy and childbirth, women are most often sent to their mother's house. They are separated from their husband. There can be a lot of stress within the household, within the family. Many women, often traditionally, culturally, women who have just delivered are kept in isolation from their family. They have a restricted diet. There are several do's and don'ts, and this enforced isolation can have a very negative impact on a woman's mental health. And these factors need to be addressed within families, within the society as a whole. Next, I'll speak about eating disorders. And eating disorders have gradually increased in prevalence in India, more so amongst the urban women, young women, especially students, college students, young women. And eating disorders such as anorexia, bulimia, binge eating disorders are much more common in women as compared to men. Twice as many women compared to men are affected by these disorders. So, women with eating disorders may either eat too little, may eat too much, may indulge in extreme dieting, and there are a lot of new extreme dieting that has become very popular with young people nowadays. There's Atkins diet, there's keto diet, there's intermittent fasting, and a lot of women especially try these extreme diets out. Some of these disorders also involve deliberately throwing up, trying to vomit after having a meal by using a laxative, or physically trying to get themselves to vomit to get rid of the excess calories, the excess food, or sometimes engaging in extreme exercise, 2 to 3 hours of exercise in a day to burn off the calories. Now, next slide, please. Uh, some of the risk factors for developing an eating disorder. Chronic dieting, when there are sometimes even there's a family history where the parents, especially the mother, has been very particular about food, about the kind of food that is prepared, that is eaten by the household, about weight, about appearance. That in turn can influence a girl, a young woman, to develop a poor body image, which in later life can lead to the development of an eating disorder. um, Being very cautious, conscious about their food, about their appearance. Associated anxiety disorders or depression are very often accompanied with an eating disorder. If a child has been a victim of bullying, body shaming because of their weight, and in Indian society, unfortunately, we tend to do a lot of that even within the family, calling someone fat, calling someone dark, calling someone, various names from a young age. It is considered to be a joke, but sometimes it can have a very negative effect on a child's personality during their growing up years, and it can affect their self-esteem. Eating disorders are also very common in people, especially women, who have a personality of an obsessive compulsive nature, where they expect things to be perfect. They are inflexible, rigid by nature, and they sometimes can transfer that rigidity to their food and to their appearance. Another important factor that can cause an eating disorder is, and which is one of the bigger risk factors for an eating disorder now, is also the influence of social media. And young women and girls are much more susceptible to the influence of social media as compared to boys. So we are inundated on our TVs and our magazines, newspapers, and definitely on social media, on Instagram, Facebook, of models, of heroines, of actresses, celebrities who look impossibly beautiful, who have got wonderful bodies, figures, and most young women then get influenced to achieve those kind of looks. They don't realize that a lot of these images are very carefully prepared, photoshopped images also sometimes, and these women spend all their day doing dieting and exercising, and perhaps sometimes even harming themselves and their bodies in the process of achieving that perfect look. But young women appear to be extremely influenced by these celebrities, and try to follow them in their day-to-day life. And this has become one of the bigger reasons for developing not only an eating disorder, but another term that we use for a body dysmorphic disorder. And young women sometimes go to extreme levels to achieve perfection in their appearance and looks. So the next slide, please. Now, borderline personality disorder does not actually come under the definition of the umbrella of a mental disorder. It has more to do with personality traits and characteristics of a person. But this is again a disorder that is more common amongst young women as compared to men. And it is characterized by a lot of volatility, a lot of impulsivity. There's a lack of stability in a person's mood, behavior. There is inconsistent behavior over an extended period of time. So this can often be confused with a bipolar disorder. And sometimes there's a lot of overlap of symptoms between bipolar disorder and a borderline personality disorder. But other symptoms of a BPD include quickly entering into and ending physical, emotional relationships with people, extreme mood swings, extreme swings in feelings towards people and activities. There is an impulsive and sometimes high risk-taking behavior. There can be a significant presence of deliberate self-harm, perhaps even suicidal attempts. And this kind of instability, impulsivity, not only affects the person, but also affects the people around the individual. So whether it's family, whether it's colleagues, friends, all get affected by the instability and the impulsivity in the person's behavior. Now, what are the factors that increase a person's risk of developing a borderline personality disorder? Usually, there's a family history of the disorder, especially amongst the women of the family. So, the mother or elder sisters, other siblings could also have similar personality characteristics, which in turn leads to a very disorganized, disjointed upbringing, which in turn affects the personality of the child, and they start mimicking their own mother's personality. Childhood traumatic events, especially physical sexual abuse as a child, sometimes brain trauma can cause these kind of personality changes, though it's not very common, but it can happen. So the next slide. Substance misuse and addiction. Now, we would not usually, a few years ago even, would not have spoken about substance misuse or addiction in the context of women's mental health. But addiction is on the rise in women in India. And most commonly abused substances by women include alcohol, cigarettes, cannabis or weed, and also prescription drugs, which is prescribed drugs like painkillers, cough syrups, maybe even sedatives, which have been, or laxatives sometimes, which can be misused, abused by women. Now, women, because of their physical makeup, because of their psychological makeup, are much more susceptible to the negative effects of substance misuse and addiction. Women can become addicted to a drug faster as compared to men, even though they may take smaller quantities of the drug, and may even take it for a shorter period of time. Women are also more susceptible to the effects of these drugs and develop side effects, develop damage to their physical health more quickly as compared to men. They also experience more cravings once they are addicted, and this in turn leads to frequent relapses. Women who misuse drugs or substances are also more commonly develop panic attacks, anxiety, depression as comorbidities. Next slide. Another important, very, very important topic that is now on the rise in India is self-harm, the incidence of self-harm and suicide amongst the Indian population, men and women both. And amongst the women, it is increasing even more. So the number of completed suicides is still, men have a higher rate of completed suicides as compared to women, and this is true the world over. But women, the prevalence of self-harm amongst women is much higher as compared to men. And self-harm in the form of cutting, overdosing, poisoning sometimes with the use of fertilizers or toilet cleaners or soap. Liquid soap is one of the most common substances used by women to self-harm, or taking an overdose of prescribed medications is another common method of attempting self-harm. But completed suicides are more common in men as compared to women. But India's average of suicide rate is much higher as compared to the global average. As we can see, it's almost double. Uh, Next slide, please. So deliberate self-harm is very, very common between the ages of 15 and 24 years. And it is 6 times more common when a woman is suffering with associated depression or anxiety. Now, common triggers for self-harm and suicide in women are dowry disputes, love affairs, illegitimate pregnancies, maybe quarrels within the family with spouse or parents-in-law, violence within the house is one of the bigger reasons for committing suicide. This is followed by these social, cultural issues are then followed by the psychiatric disorders. So women who suffer from depression or anxiety often feel suicidal and attempt self-harm or suicide, and followed by the presence of chronic physical illnesses, which in turn can lead to depression, anxiety, followed by suicide. Next slide, please. Now, what are the treatment options for common mental disorders? Usually, we need a holistic approach to treat any illness. That is true for even physical illnesses. And most definitely for mental health issues, it needs a holistic approach and a multidisciplinary approach. And this has to happen at the level of the individual, the family, the community, and society as a whole. For the individual suffering from mental health disorders, usually a combination of medications, counseling, and certain lifestyle changes are required. For milder issues, mild depression, mild anxiety, counseling or psychotherapy for the individual, for the family is all that is needed. So some level of psychoeducation, awareness about the diagnosis, about the cause of the illness, about what the individual can do to get better soon, about the need to follow through with prescribed medications, follow up with the doctors and the nurses is very important. And we need to involve the family members as well. There is a role for psychiatric medications if the situation demands it. For more moderate, severe cases, a course of psychotropic medications is essential. Now, there's a lot of myth in society, and this is because of maybe the way we depict mental illness, treatment of mental illness in our films over the years or in TV serials, that people are very apprehensive because of these myths that surround medications and other treatment options for common mental disorders. People believe that some of these medicines are long term. Once you start on these medicines, you cannot get off it. You have to take it for the rest of your life. They are addictive. They are sleeping tablets. Psychiatric medicines are only sleeping tablets, or they can cause a lot of weight gain. They can cause a lot of damage to the physical health, to organs like the heart or liver or kidney. But I would like to inform everybody listening to this webinar today that psychiatric medications are one of the safest group of medicines to prescribe. Yes, there are side effects. Yes, there are certain precautions that need to be taken. Yes, the patient and her family needs to be aware of these the risks and the other precautions that need to be taken while a person is on treatment. But these are very safe medications that can be taken by children and by adults. There are other treatment options, procedures that can be used, like brain stimulation therapy or electroconvulsive therapy, also known as, we call it brain shocks also. Again, there's a lot of myth about ECT, but thankfully with modern medicine, with counseling, with better awareness, the need for ECT has reduced in most psychiatric practices nowadays. There is a role for complementary alternative treatments in the form of yoga, in the form of Ayurvedic or homeopathic treatment. And this is what I mean by the term holistic treatment, because these alternative forms of treatment or therapy are also quite effective. And coordinating, combining some aspects of all these areas can help individuals and families quite significantly. Again, a very important part of treatment would be family support, support from the local community. There are support groups that are now coming up for various disorders, online, offline, and accessing these support groups can be very, very helpful for an individual suffering from mental illness. The next slide, please. Yeah. But most importantly, what are the steps that all of us, any of us, should and can follow to cultivate, develop, maintain good mental health? And I think prevention, as we all know, is better than cure. And there are lots of things that we all can do on a day-to-day basis that will ensure that our emotional health, mental health, spiritual health too remains in good condition. Now, there are certain risk factors like biology, gender, the genetic influence from our parents, from our ancestors that we can't change. There are also environmental factors like pollution, the country that we stay in, the society that we stay in, that we can't change beyond a point. But there are certain things that all of us individuals can and should do that will help us to stay well. For women, again, in the context of women, Indian women, staying connected. And this is something that women very often miss out on because India is a unique culture. And women tend to be more involved in playing traditional roles within the family, taking care of the family, childbearing, child rearing, the day to day household activities, very often keep women away from each other. We sometimes can be so busy because a lot of women now are going out, working outside during the daytime, managing the house at home. It's a known fact that women work, two shifts almost. We work more hours as compared to men because we have to work outside the house and we have to work inside the house also. Women are also expected to stay very strong, very brave, very patient, very kind, very caring for the whole family. And in doing all of this and playing this role, very often we neglect our own health. So we end up not having made a lot of friends. We don't have a strong network with our neighbors, our old classmates, our colleagues. We don't maintain close friendships. And one of the most important things that any woman can do is maintain a few good friendships, have some family support, develop healthy relationships with people around us so that that network can support us at times of stress and crisis. Another important, some of the points that I'm going to speak about can seem very simple, but it is these simple points, if we can follow, because we all will realize as I go through these points that we don't follow all of this quite consistently in our day-to-day life. So the next point is good sleep. And 6 to 8 hours of good sleep every night is essential. A good night's sleep helps us to refresh, replenish our energies. Our physical health remains well, our mental health, especially our memory, ability to concentrate, ability to focus, improves if we get a good night's sleep. And a lot of us are sleep deprived. Women, especially, are sleep deprived. One, because of the amount of work that a woman has to get through during the day, but also nowadays, because of the presence of mobile phones and internet, a lot of us are on our phones late into the night, whether it is Facebook, whether it's WhatsApp, whether it is playing games, whether it is chatting with other people, using social media, watching TV, web series, but this is cutting into our sleep time. And that's why the general advice is that we need to get off TV, we need to stay away from our gadgets, we need to shut down internet at least 1 to 2 hours before our sleep time. Instead, we need to try and read a book, try and listen to music, maybe try and read a magazine or newspaper before, and try to calm down and wind down from the day's stress before sleeping. At least an hour before sleep has to be a quiet time. The next important point is to get active, to stay active, to engage in regular exercise. And again, women do not usually do much to be physically active. at least half an hour to 45 minutes of fresh air, exposure to sunlight, be it a regular brisk walking, whether it's yoga, whether it is exercises, but some playing some games, badminton, anything with neighbors, friends. We need to have some level of physical activity per day and try and stay fit and active during the day as well. Avoiding daytime naps, avoiding lying down during the day, avoiding getting into bed during the day and using our phone, or finishing work and having afternoon naps. All of this affects the quality of sleep at night, but also makes us feel more dull. So becoming active consistently, at least 4 to 5 times a week, having decent exercise and physical fitness, attention to physical fitness is very important. Eating a healthy diet is again a very neglected part of a woman's life. And even educated women, working women, college students especially, very often I see young women in my clinic and hardly anyone eats breakfast nowadays. So everybody gets up just half an hour before they have to leave home. Everybody gets ready very well, very smartly, but they leave home on an empty stomach because there's no time to eat breakfast. So I would like to remind everyone here today that a healthy breakfast, a good breakfast, a nutritious breakfast is an extremely essential part of one's day. And because on an empty stomach, not only does it increase physical health issues like acidity, gas, constipation, but hunger also stops you from being able to concentrate on your work. It can make a person irritable. It can reduce your productivity. It can affect your memory over a period of time. And the vitamin deficiencies, the mineral deficiencies that accumulate over a period of time can affect your reproductive capacity. It can cause a lot of physical health problems, orthopedic problems in your midlife and old age. So, 3 healthy meals in a day, eating a variety of fruits and vegetables during the day, drinking enough water, which is again another area of neglect for women. Drinking enough water, at least 2 to 3 liters of water in a day, is essential for maintaining good health. So, this point, which I've mentioned before, also reducing media, social media use, reducing the use of mobiles. We have all become addicted to our mobiles, and all of us nowadays are, I meet even couples who live in different cities or friends who nowadays, instead of picking up the phone and talking to each other, just communicate through WhatsApp. And days can go by and people are hardly talking to each other. Even within the family, everybody is busy with their mobile phone. And even maintaining eye contact for any period of time with your family members or friends and engaging in face to face conversation is slowly reducing, and this is not healthy. It leads to more isolation. Isolation leads to a lot more of negative thinking, lot more preoccupation with one's life, which in turn leads to increased stress. So we need to try and give ourselves dedicated slots during the day where we spend time away from our mobile phone and preferably with family and friends. We have to find effective ways to handle stress. I will speak more about that next. Um, we have to try and quit smoking, substance abuse, try to, so in our bodies remain healthy, remain fit. So smoking, substance abuse, alcohol can also affect our sleep, affect our ability to eat well. It can affect our ability to work hard, again, which predisposes us to developing mental health disorders. And the last point is to get help. Because of the stigma, because of the lack of awareness, many women, and this is called the treatment gap, which means the prevalence of mental disorders and the number of people who get help for these mental health conditions is as high as 70% in our country. So, most people, and most of us, is due to lack of awareness, but another important factor is also the stigma of accepting or letting family or friends know that you're going through some mental health issues, and to even access help by meeting a psychiatrist or a psychologist. And I see that in my OPD quite often, where sometimes even colleagues will call and ask that I need to refer somebody, but how do I refer them to you? If I use the word psychiatrist or psychologist, then they will be very angry with me and they will not even take me up on that. They will say that the doctor is not good and is unnecessarily sending me to the psychiatrist for treatment. I sometimes even have family members who come and tell me that, doctor, we can't tell you that you are a psychiatrist. Can we just say that you are a friend and not say that you're a mental health professional? So there's a lot of stigma, there is a lot of resistance in accepting that any of us could suffer from mental health issues and that we may need help by meeting the correct mental health professionals. So next slide, please. So psychological resilience is another very important aspect that all of us have to develop, especially women, because like I mentioned before, emotionally, psychologically, we are quite vulnerable, sometimes can even be volatile. And this in turn has made women much more vulnerable to develop mental health issues. Now, we see this happening very often in society, that when women cry or when women get angry, then we are usually labeled as, creating drama, or something is wrong with us, or hey, why are you behaving like a mental person? So these are the comments that women have to hear sometimes. And this is mainly because emotionally, women are not as strong as compared to men. And that's why it is important that we develop this psychological resilience, this emotional stamina to deal with stress, to deal with crisis. So resilience is nothing but the ability to mentally, emotionally cope with a crisis, to remain calm during a crisis, and the ability to bounce back from a crisis, from a setback, to move on from the incident without any long term negative consequences. So, how do we develop strong coping mechanisms? How do we become assertive? So these are traits that we need to develop. These are qualities that for some people it comes naturally, but for women, we need to sometimes learn to be assertive, because culturally, traditionally, women are quite sacrificing in nature. The role that we play in our families, we take care of everybody at home. We let go of our own needs sometimes to satisfy the needs of our family members. Even within the society, we feel pressurized to behave in certain ways. So it is to get married at a certain age. We are expected to have kids by a certain age. We are expected to have a male child. Society expects us to work in a particular way, to behave in a particular way, and that puts a lot of pressure on women. So, how do we learn to be assertive, to balance our own needs, our own requirements, our own wishes, and balance it with the requirements, needs of the family, the company, organization that you work in, the society that you belong to? And that is a quality that most of us women need to learn, because that makes us stronger while dealing with negative situations, crisis in our lives, and this is an inevitable part of life. So there are going to be ups and downs in our life, and we need to be able to go through it, experience it. Next slide, please. So, what are the 10 ways in which we can build psychological resilience? I've mentioned some of these points before. Maintaining good relationships with family and friends is very important, because when you have a good peer group, a good friend circle, people with positive outlook towards life, you get to learn quite a lot with one another. And you get to see that some of the issues that you may be going through, some of your family or friends are also going through similar experiences, and you can be quite supportive of one another, learn from one another. Otherwise, if we are too isolated, we may get overwhelmed by the problems in our life, and we may think that we are the only ones who are suffering in this manner. But when you have a support system, you realize that some of these experiences are quite common, and there are ways of dealing with it. There are ways of getting through these negative experiences. We have to learn methods, ways to avoid seeing crisis or stressful events as unbearable, unsurmountable problems. we need to become more accepting that there are certain circumstances in our lives that cannot be changed, because we all know that sometimes we get into the situation of why. So even now I'm meeting a lot of people who have become coronavirus positive despite taking all the precautions. They or their family members have tested positive, and I have a lot of women who are asking why did this happen to me, why did I become positive, what will people think, how will I cope. So it's important to accept sometimes that despite our best abilities, sometimes we may have to go through rough phases in life, and these circumstances cannot be changed. It would be better to stop asking why and rather accepting the circumstance that you are in and find positive ways, healthy ways of dealing with the situation and moving on, overcoming the hurdles in your path and moving ahead. Right? To We need to develop realistic goals and move towards them. So sometimes again with women, because of the expectations, because the burden that society places on them, can sometimes have quite unrealistic goals. And I see this very often in women when it comes to education, that we have to come first in class, we have to get a seat in a particular college, and if you get lesser percentage, if you don't come first, then young women, college girls tend to become very, very anxious, tend to lose their self-respect, their dignity. But it is important to set realistic goals. There are women who sometimes have difficulty conceiving, or who have given birth to female children instead of male children, and they tend to get too anxious, too preoccupied because of the burden that society places on them, and can go to set a lot of unrealistic expectations from themselves and go to extreme means to try and achieve their unrealistic goals. But this in turn makes them very, very vulnerable to develop mental health issues, develop a lot of stress, which is not healthy for them or for their families in the long term. So it is important that we are practical, we set realistic goals, and we find a way to work towards achieving them. All of us are confronted with adverse situations in life: job losses, failure in exams, difficulty in our marriage, difficulty in our friendships, a financial crisis. So there can be difficult situations in our life from time to time. How do we learn to be decisive, assess the situation, assess the options in front of us, and how do we learn to take quick decisions and stick with our decisions and get through the crisis rather than being dependent on other people, other family members, or trying or giving up, collapsing, and just let the situation overwhelm us. So it is important that we learn how to improve our decision making skills. It is, again, life is a journey with its fair share of ups and downs. And each crisis, and no one wants to have a crisis in their lives, but we also need to accept that crisis is going to be an inevitable part of our life. And we have to be able to use each crisis as a tool for growth, for building our psychological resilience, for self discovery, for strengthening our personality, and to be able to move on. So while we are going through the crisis, it may not be an enjoyable experience. But if all of us look back, we can realize that each crisis has taught us quite a lot about ourselves, about our lives, and it has made us much more stronger, much more capable, much more independent. We need to learn how to develop our self confidence, our self esteem, how to maintain our self respect and dignity. And this won't happen staying at home. So, women need to learn now to step out, not just for work, but also to develop friendships outside of the family, to maintain these friendships, to participate in extracurricular activities, to develop hobbies, to participate in some group activities in the society, because all these interactions with other members of the society helps us to develop our self-esteem and our self-confidence. It is important to keep a long-term perspective and to control and consider the stressful event in a broader perspective. Sometimes when we are confronted with a problem, we just like a microscope, we try to focus only on that small problem, and we forget to see this problem in the context of our whole life journey, in the bigger picture. And the and when we tend to do this, microscopically look at every little thing in our lives, negatively try and analyze it, then every little problem then just looks too huge and too unsurmountable. We need to learn how to maintain an optimistic and hopeful outlook. And so that's why I say usually that instead of always asking, what if I get the coronavirus? What if I fail? What if I don't get the job? What if something happens to me? Instead of what if, we need to start saying, so what? So what? I hope it doesn't happen, but if it does, so what? I will go through it. I will face the situation, right? I will be strong. I will be positive. I can do it. So I think it is important to develop a very optimistic and hopeful outlook. It's important, the last point, to take care of one's mind, one's body. So good sleep, good diet, regular exercise, a healthy support system, having hobbies, extracurricular activities that we regularly engage in. I think this is very important way to develop psychological resilience, which in turn reduces our vulnerability to develop mental health disorders. So next slide, please. So what needs to be done from a community, society, the country's perspective? What needs to be done in the area of mental health, and especially women and mental health? So the biggest tool is going to be education, empowerment of women. And education, knowledge is power. So that leads to increased awareness for a woman of her rights, be it nutrition, be it right to education, in the job front, becoming economically, financially independent, being aware of her rights within the family, within the society. So education is going to be the biggest factor. Literacy is going to be the biggest factor that is going to improve women and their position in society. And in turn, that will have a very positive impact on their mental health and emotional health. Reduction of discrimination. So there still exists, unfortunately, in all walks of society, there exists gender discrimination. It could be based on caste. Definitely gender discrimination exists in our society, within the family itself, within the community. And that is why a lot of programs need to be created, a lot of long-term strategies need to be created, awareness needs to be generated within families, within communities, within society as a whole, to reduce this discrimination on which we all women experience on a day-to-day basis in our professional lives, in our personal lives. I think Indian society is in a position of shift. The role of women in our society is changing. So women are going out and working. Women are becoming economically independent. So this changes the role of men and women in society. But it is important to realize that families as a whole have to work towards improving the position of women, the respect towards women in their families. And that's how slowly there will be cultural changes as a whole. Again, a very important point is ensuring availability, not only availability, but also affordability, accessibility of mental health care services for the entire society. Now, a lot of the psychiatric services, mental health professionals, there are very few of us who are available in India. For the burden of mental health issues that is afflicting our society, the number of mental health professional services involved are very few. Affordability is an issue. Accessibility for women, families living in rural areas, semi-urban areas, there's hardly any access to good quality healthcare services, psychiatric services. So this needs to change, and the government needs to come up with proposals to not only implement the Mental Health Act more effectively, but also to provide affordable, accessible mental health services across the country. So there needs to be cultural reforms, social reforms, economic, legal, constitutional reforms. And when all of this hopefully comes together, happens from an individual's level to the level of society and the government, then I think we can look forward to reducing the impact of mental illnesses on women in India. Thank you.
Yes. Thank you very much, madam.
Thank you, sir.
Your speech was wonderful and most informative. I think most of the counselor and psychologists they have been impressed by your speech, madam. You are issuing the complaint, wishes and compliment about your speech, madam.
Thank you. Thank you.
Because you have covered everything, madam. The knowledge which is essential to manage our mental health, everything you have been covered. And you also suggested what kind of model should be there to manage the mental health of the women's, and how what are the factors going to be leads to the psychological disorders, and how social structure and economic structure of the society is going to lead to the psychological disorders. Almost all essential information you have been delivered in this session, madam. Now it is time to propose vote of thanks. Now I have questions, madam. This is session for open. This is for a session for open, madam. There will be some questions.
Sure.
I will put the questions on slides, madam. Kindly respond to those questions, madam. Yes. Okay, questions. Yes, madam. This is first question, madam.
Right.
Yes, madam. Yes, madam. Madam, this is question. When I was a student of psychology, our professor used to say, none of is that free from the diseases, because every time you're adjusting with maladjustments going everywhere. We are thinking different and acting different. So in these cases, how can you say my mental health is good? So how can you address Indian context?
Yes, I think that's a very interesting question, because what is normal, and how do we define what is normal, and how do we judge who is normal and who is abnormal? But I think within the society there is a certain framework within which we all function. And there are certain do's and don'ts that we all realize when we interact with one another. So, socially, culturally, there are certain do's and don'ts, certain accepted modes of behavior and communication. You're right that all of us are susceptible, vulnerable to develop any kind of mental health disorder. And that is why, if also the bigger challenge in someone suffering from a mental illness is sometimes they're not even aware that some of their behavior, some of their thought processes may be abnormal, right? Maybe that there is a psychiatric disorder which needs to be addressed. And that is why sometimes even identifying a person with mental disorder may be an easier part, but getting them to accept it, acknowledge it, and getting that individual to come and access treatment, accept treatment, could be a very challenging part sometimes. So usually someone suffers from a physical health issue, it is possible to tell them that, look, your blood sugars are high, you may be suffering from diabetes, you need to go and meet a diabetologist. So the person may not be happy, but will accept that feedback and will go and meet the doctor, right? Because there is no stigma attached to it. But it is not the same with a mental health illness. It is sometimes very difficult for even family members or friends to discuss this topic, right? So we may hesitate from pointing out that there could be certain abnormalities that need to be addressed. So there is no set criteria, there is no certain diagnostic test, but there is a broad range of acceptable forms of behavior, communication, thoughts. And if we notice any fluctuation from the same, then we need to try, if we identify it ourselves, we need to go and get help. If our family or friends we feel are suffering from an illness, then it is our duty to highlight this in a sensitive manner and to ensure that the person gets the help that they deserve.
Yes, madam. The second question from Hanumantai Pujar, madam. You can read it, madam.
Yeah, phobia is going to reduce sports performance, and why? I think, yes, phobia, phobic anxiety disorders can affect all parts of life. And if a person has developed a phobia for a particular situation or an event or an individual or an object, then it can cause a lot of distress, disruption to a person's life. So if a person is filled with anxiety, filled with fear, filled with the sense that something bad is going to happen, then it is going to affect their ability to function in day-to-day life. So be it sports, be it academics, be it their professional life, family life, all areas can get disrupted. Does going to the gym is recommended during the pandemic, because government of India had given permission to open the gyms in lockdown. I'm not an expert in this area, but yes, I feel that given reasonable precautions, it is okay to go to a gym. Because coronavirus is here to stay for some time, until we get a vaccine, until the virus loses its virulence and dies down, until we develop herd immunity. Um, uh, and all of that may take a few more months to happen. So till then, we have to learn to live with coronavirus. Now we know enough about coronavirus, the way it spreads, the people who are more at risk to develop some morbidities or mortality because of the virus. So yes, it is safe to go to a gym, provided you come in the right age group, you're reasonably physically fit, you don't have any comorbid problems, diabetes, hypertension, obesity, any other health related issue. If the gym that you have chosen is following all the proper guidelines, procedures, sanitization, it's not overcrowded, the equipment is cleaned properly, you are also using a mask, you're not getting too close to other individuals, you're using hand sanitizers before and after your gym workout, if the area is well ventilated. So keeping all these factors in mind, yes, it is safe to go to a gym, safe to go to colleges also, I feel, safe to attend classes, provided these criteria are fulfilled. So the next question, please give some suggestions for parents and children to develop mental health. And I think this is a very important question, because nowadays with the breakdown of the joint family system, so we are all living in nuclear families, most of us. There are no grandparents staying with us. Most families, parents, mother, father, both are going out to work. And sometimes children are left unattended, or they are left with some maid for a few hours until the parents come back from work. And life has become quite stressful. So parents also have to come back. They hardly have time to spend with their children. They're busy cooking, managing the house, getting homework done. So all of this has disrupted the family life that we used to enjoy when we were young. Also, presence of internet, mobile phone, internet addiction has disrupted family life even more. So it's very important that parents realize that they need to show by example. And when I spoke about psychological resilience, if they want their children to grow up to be balanced individuals, who can deal with all the ups and downs in life, then they have to show by example. And setting a healthy routine at home, waking up early, exercising, eating good food, respecting one another at home, father, mother, respecting one another at home, working together as a team to take care of the children, manage the home, manage the finances, respect each other's work, support each other in their work, respecting their children, encouraging them, introducing them to different experiences apart from just academics, because Indian society, we tend to focus quite a lot on academics and performance in school and college, right? We all want our children to come first all the time, right? Do well compared to, and we would like to compare our children to other people's children. And this is, we do this commonly as part of society. We need to, as parents now, improve our ways, expand our ways of thinking, and be good role models for our children, and set some important healthy habits from a young age onwards. So the next question, why women students are not eating proper nutrition food? They always want to eat junk food, and that's why they're suffering from anemia. I think not just women students, students as a whole are not eating well. Some of it is because of their poor lifestyle habits, their poor sleeping habits, staying up till late in the night, waking up late in the morning, not giving themselves any time to eat healthy breakfast. Some of it is also influence from other peers, that it is more cool to go out and eat in the canteen, to eat junk food outside, because that's one way to socialize. That's a reason to go out and spend time with friends. For girls in particular, appearance, body weight, fitting into the right clothes, looking good, is one of the big reasons why women tend to neglect, young girls tend to neglect their health. And for slightly older women, younger women in the 20, 24, 25 age group, some maybe women who are married, it is the burden of managing their professional lives or their academic lives while taking care of young kids, taking care of their home, and they tend to sacrifice their sleep and their meals in this quest of being perfectly able to manage home and profession. So this is not healthy. Whatever the reasons may be, good food, healthy nutrition is essential. And that awareness, I think, has to be now spread. Shubha asked that she has gone through postpartum depression after 2 miscarriages. She's now blessed with a baby girl who's now 13, but she's still not over her grief. I can imagine, I can imagine the sense of loss that you must still be feeling, even though you have a healthy child. Your child is already 13 years old. It will still not make up for the two losses that you have had. And I think if you're still suffering as a result from time to time, if it affects your mood, then I think it is important for you to avail some counseling. And I think that will help you process through your grief. And it will help you. You may not forget, you will not forget, you should not forget, but you will be able to accept what has happened in your life and move on. So, suggest some strategies of prevention to overcome mental violence for women. I think we have to, it's all our responsibilities in our little families, extended family, our friend circle, our colleagues, our society, our neighbors. I think there's a culture of silence that we all practice when it comes to violence and abuse towards women. A lot of us have seen this happening, perhaps even in cafes and on the roads or in our neighbors. We hear loud sounds, we hear the sound of some fights happening, but we usually tend to stay away and not interfere and keep quiet, even if this is happening in front of us. I think this culture of silence we have to get over, and we have to start talking about the presence of abuse. And this can be any form of abuse: mental, verbal, physical, sexual. We have to start talking about it. It is up to parents, up to families, that we teach the men in our families, also our boys, on how to respect women, on how to work with women, on how to treat women equally. And only when this starts happening at every family, then this cultural revolution will spread through the community, through the society. And this has to happen in our professional lives, in our personal lives. And it's all of our responsibilities. Why women are more prone to mental stress than men. I think this has a lot to do with the psychology, the makeup. Emotionally, women are much more emotional uh, as compared to men. That has a lot to do with the chemicals, the neurotransmitters in our brain, the way we think, the way we feel, the way we respond. So it is our mental makeup. Uh, Along with that, traditional cultural roles, the place that women occupy in society, the discrimination that exists in society against women, and the experiences that women have to go through as a result from a young age. Whether it is access to education, whether it is nutrition, whether it is how boys are treated within the family as compared to girls. In so many families, we see that girls are expected to do the cooking, cleaning, while boys are not expected to do these roles, where girls are expected to get married at a certain age. Girls are, there is dowry harassment. When it comes to jobs, also women have to somehow manage their home plus go out and work. So women are at each and every stage in their life, have to play certain roles, are expected to behave in a certain way that puts them at a lot of stress. and emotionally, because they are much more vulnerable as compared to men, the risk of mental health issues in women also is much higher as compared to men.
Yes, thank you, madam.
Thank you, Dr. Mali
Because,
Patil.
madam, there is a lot of questions are coming from the delegates, but due to the constraint of time, she
Sure.
could not able to answer
Sure.
all the questions. So we requested them to response through the.
Sure.
Now, madam, I convey all the wishes and congratulations and compliments we are reaching from the delegates to you, madam.
Thank you.
Because
Thank
all they
you.
have because they are putting, they're sending a lot of congratulations, madam, to you.
Thank
Now,
you.
this is
Thank
time to propose a vote of thanks. Now, I request our colleagues, Dr. Hanumantaya Pujari, sir, to propose a vote of thanks to all the dignitaries and resource persons of the today webinar.
Thank you. I wholeheartedly thank our beloved Honorable Vice Chancellor, Professor Onkar Gaud Kakde, for his constant support and guidance. Thank you, sir. I heartily thank Professor R. Sunandamma, the Registrar of our university, for her encouragement and love. Thank you, madam. I also thank Professor P.C. Tarsar, Registrar Evaluation, for his never-ending support and cooperation. Thank you, sir. I express my gratitude to our Finance Officer, Professor Vijaya Korishetty, for his genuine concern and support. Thank you, madam. And really, I wholeheartedly thanks to Dr. Preeti Patil, Madam Ji, a resource person of today's webinar, for a wonderful and thought-provoking address. Thank you, madam.
Thank you. Thank you, sir.
I thank Professor D.M. Jyoti, the chairman of our department, for his valuable guidance and support. Thank you, sir. I wholeheartedly thank Dr. Rajkumar Mali Patil, Associate Professor and Organizing Secretary of this great academic event. Thank you, sir. And this time, definitely, I should remember and thanks to Professor N. Chandrappa and Dr. K.P. Martin for their love and guidance. I thank my all fellow colleagues and non-teaching faculties of our department for their support. I also thank to the ICT team and becoming Dr. Rajesh for the great help in making this event great success. Thank you, sir. At last, I thank all the teaching and non-teaching faculty of our university. I also thank all the participants and media personnel. Thank you so much, one and all. By this, the webinar will be end. Thank you.
Thank you.
Thank you, madam.
Thank you.
Thank you.